Hi there, my name is Ed and I'm a psychological wellbeing practitioner here at Private Therapy Clinic. Today we are going to be doing a QBcheck with Dr. Becky Spelman, who is the CEO of Private Therapy Clinic and a registered psychologist. Today we are going to be doing the QBcheck on Becky, who is suspected she's had ADHD her entire life. And the QBcheck will give a brilliant indication as to the severity of these symptoms, which we'll go through in the video.
I've always felt that I might have ADD. So I think I have ADD, so not necessarily the hyperactivity kind.
Yeah.
I've never had any tests at all. In school I couldn't concentrate at all for my entire primary school, secondary school, and all the way through university, and I did a lot of university.
Yeah.
So concentration and focus was always a problem for me. And I have learned really good coping strategies over the years, so I am able to focus now, but there's definitely still situations that I find challenging. So I believe you've got a test that is going to help me maybe know if I might have ADHD or ADD.
Yeah, definitely. So today we're going to be doing the QBcheck. Now the QBcheck is an ADHD test. So it is a measure of the 3 core ADHD-like symptoms, those being inattentiveness, impulsivity, and hyperactivity. Now it looks to do this with a stimulus response task, and it takes about 20 minutes. And what it does is it compares your results to a gender and age matched control group and a gender and age matched ADHD group alongside subjective rating scales to suggest the likelihood that you have ADHD.
I'm so excited because all of my life, as I said, I've thought I must have ADD, and I was never diagnosed with it. And it's funny because I've been in this industry for a really long time, and I work very closely with people like yourself and psychiatrists who diagnose ADHD all the time. And this is the first opportunity for me to ever see a professional and ask an opinion as to whether I might really have this disorder.
There's a few reasons why someone might want to do a QBcheck. So I think the first reason is kind of given your situation. You think you have ADHD, but you've never done a full assessment, you're not 100% sure. And so the QBcheck is kind of the perfect stepping stone for you to make sure that what you're thinking, your symptoms are presenting as actually are what they are. You know, these words, inattentive, hyperactivity, impulsive, we've all felt this before. So at what point is it ADHD? Well, the QBcheck provides a brilliant foundation of kind of objectiveness behind this findings, so you can understand just the extreme to which these ADHD symptoms might present. Now, the other reason someone might want a QBcheck is if maybe they're on medication, they want to view the benefit of the medication. So having a QBcheck after you've titrated to an appropriate dose.
What does titration mean?
Titration is where you work up to the most effective dose with the fewest side effects and the best impact at mitigating your ADHD symptoms. So it's kind of like the most appropriate, effective dose that you can be on. And once you've got this, typically with ADHD medication, you should find that it's helping you. And the QBcheck is a brilliant measure for you to understand the benefit of the medication. You know, not just so that you can see the medication is working, but so that you can see maybe where it isn't, so that you can better find approaches and ADHD coaching to mitigate the symptoms that are left of your ADHD.
It's really interesting. Is it a diagnosis in itself?
So the QBcheck by itself is not a diagnostic tool. It does aid diagnosis, and many practitioners are big fans of it and like to use it in their work.
Okay, and what kind of environment do people need to be in relation to having the QB?
Yeah, of course. So it's a stimulus response task, but I'll get on to explain fully what it is in a minute. But you do need to be in an environment that is quiet. You need to be in an environment that you're comfortable in. Typically somewhere at school, or if you're going to school, or at home, it is good with fewest distractions as possible. So if you've got loud clocks ticking in the room, take them out. If you've got people going around your environment, maybe mum and dad or friends or family moving in and out, you need to try and stop this. And it takes 20 minutes, so maybe letting people know in the house that you're doing this test is probably the best thing to do. When you actually go on to do the QBcheck, there's a few questions in there regarding making sure that you're on a chair, you're upright. Some things are quite silly and some are more obvious, like remove a phone from your environment that might be distracting, or put it on silent, these sorts of things.
So I've come in to have this face-to-face today, but you mentioned people having this at home. Can it also be done remotely?
Yeah, definitely. So it can be done remotely or it can be done online. The only prerequisite is that you have a computer. The computer is not a cardboard box, it works, it's good, and that it has a web camera. And so these are the only prerequisites. Now, it's a stimulus response task. So what does that actually mean? I've mentioned it a few times. you'll be presented with a series of images, so shapes, squares or circles of different colours, so red or blue, and you will have to respond pressing the space bar every time you see an image that is the same, so maybe a square you're seeing twice that is also the same colour. Now, every time you're seeing these images that are the same, you're responding, and it's recording your reaction time, it's recording your correct responses, it's recording your incorrect responses of 2 types, which we'll get onto later, to analyse all this data, and then it presents it broken down alongside a total ADHD symptom score.
Okay, is it also looking at my movement?
Yes, so the web camera I mentioned briefly does track your movement via facial recognition technology. It doesn't record anything at all, it just tracks your head movements throughout the test.
Okay, is there anything that I need to consider when doing this test?
Are you on any caffeine or stimulant medication?
No, I gave up caffeine about nearly a year ago actually.
Interesting, no, then that's the only thing you need to be considering.
Okay, great. So people of all different ages wonder if they might have ADHD. A lot of parents come to us and ask, you know, whether we can assess their child, but there's a lot of adults that come to us as well. So what kind of age range does this test cover?
So the QBcheck can be used for people from the age of 6 to 60. There are 2 variations of the test. The one we'll be using today is the one from ages 12 to 60. And there's a slight variation for people from 6 to 12. But the brilliant thing about the QBcheck is it doesn't care about your mathematical ability or language or problem solving skills. It's very, very straightforward and can be used at almost everyone.
Okay, cool.
How are you feeling today? Are you ready for the test?
I'm really excited. I'm very curious as to what it might, you know, the outcome of this, because I've developed such great coping strategies over the years that even if I have some attention difficulties, I can kind of overcome them. So for that reason, I think my results might be quite positive, as in quite good results, and you know, and that you might not be recommending that I go and have an assessment for, you know, full assessment for ADHD. But on the other hand, I have a curiosity to see actually how do I perform compared to someone else. I'm also very competitive, so I really want to win. I want to win at this test. So I'm going to be really trying very hard. But actually, I think that sometimes when people are trying too hard, then they can end up, you know, scoring high on maybe the impulsivity because they press the button too fast.
Yeah, definitely. You know, over-focus, under-focused. The test works where the further it gets, you have more pressure on your ADHD-like symptoms. Typically, 5 to 8 minutes in is relatively okay for most people. That's not to say there aren't people who would struggle with that, but it's further on in the test, that's where we see the real difference. And definitely your head movements, and typically we find people's head movements will move more as they get further into the test and they struggle more with it. So yeah, be as competitive as you like, Becky, but we'll see. The test doesn't lie.
Is the test designed to be boring?
It isn't designed to be boring as such. That's a misinterpretation some people have, but it could be seen that way. It's just designed to put pressure on your symptoms. People find it boring because it's so simple. And it's so simple because everyone needs to be able to do it. So it is boring in the sense that you do it for a while and you'll struggle to maintain focus, or you won't. I mean, we'll see, won't we?
Yeah, we will see.
But yeah, so it's not boring, but it is repetitive, is a good way to say it.
Okay, yeah, I'm not sure if it's going to be like adrenaline, or I'm going to be really nervous, or I'm just going to be yawning, so let's see.
During the test, the following 4 symbols may appear on the screen. A red square, a red circle, a blue square, and a blue circle. Your task is to press the spacebar when a symbol of the same shape and color is repeated. Your task will be to respond to get symbols on your computer screen by pressing the spacebar as fast and correct as you can. During the test, the following 4 symbols may appear on the screen. A red square, a red circle, a blue square, and a blue circle.
Hey Becky, so how did you find the QBcheck?
Well, I'm quite a competitive person, so I was trying really hard.
Okay.
So, I mean, I made extra effort to try and do well in the test. So, you know, I was coming up with like my own little strategy as to how to pay attention so that I could do.
So you think you did pretty well overall?
I think I did really well. I think I only made a few mistakes, so I'd be surprised if I didn't do well in the test, because I was like focusing on it as if my life depended on it.
Okay, so we've got some interesting results which we'll go into now. Okay. So I'll start with this. So the QBcheck breaks down all parts of the ADHD-like symptoms. It looks at the activity, the impulsivity, and the inattentiveness. Breaks it down into 3 parts, and it also does an overall total ADHD QBcheck symptom score. So the test taker had a QBcheck ADHD total symptom score of 57 out of 100. Now what does that mean? A score above 50 represents a high likelihood that you have ADHD-like symptoms. So if you think about it out of 100, I mean, I've done lots of these tests. I haven't seen many people get more than the 70, 80, 90 mark. So you're kind of on the cusp, but it suggests you have ADHD because 57 out of 100 and more than 50 is a high likelihood.
Oh my God, that's crazy. Like my entire life I have suspected that I have ADD, and I've often said this in conversations. I kind of say it all the time, and I'm like, we're never even diagnosed, so I have a right to suggest so many times that I might have ADD. And the reason I say ADD, I've ruled out the hyperactivity side of it, because I don't think I kind of have so much of that side of it, but it'd be interesting to hear your thoughts. Yeah, interesting. So of the inattentiveness, you'd say that's the predominant part, and you'd say maybe not so much hyperactivity and impulsivity a little bit maybe, or not at all. I don't think I'm high on impulsivity, although if I have thoughts in my head while I'm having a conversation with someone, I'm always worried that like I'll forget those thoughts, and then that can lead me to sometimes interrupt people.
Yeah, so really predominantly just inattentive is the thought. Okay.
Yeah.
So in a minute we're going to show the QBcheck results in a bit more detail, but I'd just like to go through a few more whilst I've got you here. So we measure the QBcheck results for activity, impulsivity, and inattentiveness as a Q score from -3 to +3, where 0 is average person, and +3 is incredibly high. So, anywhere from maybe 1.5 to 2 onwards, you're still looking at a really high score, where the higher the score, the more ADHD looks to be present. So when looking at activity, you had a 2.3 score out of 3, which is pretty high. So this is hyperactivity. Obviously hyperactivity being the symptom, but activity is what it measures. When we look at impulsivity, we have -1. So, I mean, as far as impulsivity as a ADHD symptom here, it's non-existent. And when we look at the inattentiveness, we've got 1.4. Now, what does that actually mean? So let's look at it as a percentile. Now, the percentile expression is a percentage, is the probability of a normative person to score below or lower, such that if you had a 95 percentile score, you're in the top 5%. If you're in the 99 percentile, you're in the top 1%. So very high. So activity with a Q score of 2.3 out of 3 being very high, you're in the top 99 percentile. So for hyperactivity, it would suggest you're in the top 1%. So really hyperactive. And that was measured using the activity graph through the test. Now later we're going to look at, it calls it Q1, Q2 and Q3 and Q4. So it takes a little snapshot of your activity recently at 4 points throughout the test, and it compares it to a sample as well. So we'll have a metric kind of to understand really what does it mean, because otherwise we're just looking at results and we don't have any baseline. We look at the impulsivity, which was -1. It was a percentile 15%. So I mean, you're very, very low in impulsivity here. This is shown by the test, and a very low percentile. And inattentiveness, we scored 1.4, which is 91%. So for inattentiveness, you're in the top 9 percentile, which is also very, very high. So the two that stand out here, hyperactivity and inattentiveness. Now in a minute we'll look at the detailed results. I'll be able to point out how it got this conclusion. We'll also look at reaction time and reaction time variance. But just immediate thoughts from that, predominantly hyperactive and definitely issues of inattentiveness. Kind of matches with what you were thinking with the inattentiveness? Yeah,
so I've known that I've had a problem with inattentiveness my whole entire life. It's interesting about the hyperactivity thing, because I'm not sure about that one. I'm quite a high energy person, so and I can be quite hyperactive in social situations where it's appropriate to do so. So I feel like I've got a lot of control over that. But what was really interesting was I was associating hyperactivity with impulsivity. But what you're saying is that I'm very low on
Correct.
impulsivity.
Yes.
Because I thought if you were very hyper, you had to also be quite impulsive. But it's very reassuring to know. I'm
not so impulsive, and very interesting as well. I mean, we find the hyperactivity comes out the most within attentiveness, which is what we look at here. And the predominant reason for that is, I think you could probably relate it to stress. So when someone's struggling to maintain attention for prolonged periods of time, typically they might be on edge or anxious. So when you look further into the test, and you might be recognizing yourself, oh my goodness, I'm not sure if I'm focusing here, you're going to have to, your head's moving, you're really getting in the zone, you're trying to focus more. That's where the hyperactivity is recorded and it comes out more. So later into the test, which we'll see here, we see typically more hyperactivity, which is reflected, and that then is in association with the reflected inattentiveness that comes out more later in the test as well.
That's so interesting, because I thought I was doing really well on the test. But it's quite interesting because at school, where I would could not pay attention, I would just daydream. Like that was my best coping strategy at the time, to try and cope with it. So I guess rather than being disruptive in class, like I wasn't really known to be a naughty kid or anything, but I was known to be as if I wasn't applying myself. And teachers would get very frustrated about that, because they would just think, well, why is she just not listening? She's like zoning out, and they really had a hard time with my daydreaming. But I was so bored in these, being forced to learn topics I wasn't so interested in. My only way of coping was kind of compulsive daydreaming.
Yeah, that's a really common phrase that we hear related to ADHD. Daydreaming is common. During lockdown, we found people who were forced to look at computer screens as well, often would get caught out because of daydreaming, or would cut in, especially with the impulsivity and hyperactivity during lockdown when people were having business meetings. They wouldn't be able to maintain focus, or they thought they knew where the conversation was going, so they just cut straight in and start speaking. But yeah, really common more recently, just coming out of lockdown. I mean, we've been doing the QBcheck for under a year, but a while at the clinic now, and when I started doing it, people were saying that in meetings they get caught out because they were struggling, and this word daydreaming kept popping up. So definitely not a direct word that's associated with ADHD as far as the QBcheck, but a common phrase that people find when they struggle with maintaining attention.
You might find this really surprising, but I did an MBA during lockdown.
Oh, wow.
But and that sounds kind of unusual for someone with ADHD, but my best coping strategy for my way that my attention works is to take control over things that stimulate me, so I can kind of chop and change and like have a whole variety of things, so that like I'm constantly focusing on things that I find interesting, and then I can engage. But if you give me something kind of boring, like if you put me in a lecture environment, it's hopeless. I had to learn how to pass exams in a way that worked for me, which is usually just cramming the night before. So I rely on my short-term memory to keep as much information as possible, and then I have to just wait till real life experiences to learn the real information later on.
Well, I mean, it seems like it's worked in your coping strategy. You've got you very well so far. I think now we'll sit down and we'll go through the rest of this in a bit more detail, and I guess you'll see this in a moment. So I think the first thing we could break down here, Becky, is looking at this half pie chart. So I mentioned earlier your ADHD total symptom score was 57. A score above 50 has a high likelihood. Now if we look at this half pie chart here, we can see this is the general population. So the test takers total symptom score equals a high ADHD total symptom level. About 7% of the general population display a similar level of ADHD-like symptoms. Now, as I mentioned, you're only
Can I just summarise that? So like 7% of the population are going to show the symptoms that I have. So then, therefore, there's a very high likelihood that I have ADHD, because most people wouldn't act how I acted on the test.
Precisely. Now, I mentioned earlier 57 out of 100, 50 being a high score. So you're just kind of on that cusp. And we see that here with the line here, with the 7% that you're in, you're only just on that 7%. Now, if we go over here, you can see what I mentioned earlier about your activity, your impulsivity, and your inattentiveness. We see the Q score, and we see the percentile here by its side. We also see reaction time and reaction time variance that by themselves aren't indications of inattentiveness, but can go quite a long way and are very interesting in combination together to help explain how people maintain focus. Now, if we look down here, we have the activity graph. So this is what the webcam was tracking with the facial movements. Now, when we look at the sample case here on the right, typically with someone without ADHD who wouldn't be struggling with this at all, we don't find much of an increase at Q1, Q2, Q3 and Q4. Now these are 4 snapshots taken throughout the test to reflect that head movement. Now,
is Q1, Q2, Q3, Q4 first quarter, second quarter, third
it's spread out throughout, so we'll get on to that just below. You'll see where the 4 points were taken.
Okay.
When we look at your data here on the left, we see a gradual increase in Q3 and Q4. And this is probably because as the test was going on, you were maybe focusing more and to maintain focus for longer. It was a struggle, and so you were moving your head as you were kind of expressing this difficulty as the test went on. Now when we look underneath, we have the attention impulse control graph. Again, we have the sample case here. Now there's 2 things to break down here. The green dots are correct responses, the red dots are incorrect responses. These incorrect responses are known as commission error, and they represent impulsivity. This is when you are presented with a stimulus and you press the space bar, but you did not need to. Underneath, we have these black lines here at the bottom. These are omission error and represent inattentiveness. This is when you are presented with a stimulus you should have responded to and you didn't respond at all. So when we now look at your data here on the left, what's really interesting is we see not a single red dot, which I don't think I've ever seen. So absolutely no impulsivity at all.
I was really trying.
And that's reflected in the -1 Q score we see just above here for impulsivity and the percentile next to it at 15%. Now, underneath we see the inattentiveness, we see the omission error. Now this is increased as the test goes on slightly, however there are consistent inattentiveness throughout. Now what's interesting is there aren't any bubbles at all. Typically people with ADHD, we might see phases of them struggling to maintain attention where they're able to bring themselves back and centre back to focus on the test again. Here that doesn't seem to be the case quite so. So what it would suggest is that your inattentiveness comes and goes throughout, but it isn't long periods of inattentiveness. Which might reflect your coping strategies, where you're able to maybe recognise you're struggling to maintain attention and then bring yourself and centre back. Earlier on you were talking about coping strategies you found to help you throughout, and this would be reflected here in the test pretty fairly. Otherwise we more likely see bubbles of inattentiveness and maybe a bit more impulsivity as well.
So what I'll say about that was I was trying really hard. I was like, really focused as if my life depended on it, and I had a system as to how I was doing it. So I was saying like red circle, and then I'd, so I was saying it in my head, so to try and stay paying attention. And it was of high importance to me to do well on the test, whereas if this was just like some random lecture environment where there's no consequences, I would have scored a lot more. I would have zoned out.
Definitely.
It was boring.
One final thing we see here from the test, I mean, you mentioned maintaining a focus and really repeating it out loud, or in your head, rather. We see the reaction time here. Now, if you look at the reaction time, it's maybe slightly more consistent throughout, and especially at the end here, when you've got a few extremities as well. This is probably where you were really struggling. Although you did do an amazing job, you can see that you were focusing more because you were taking longer to respond to them. This is reflected in the reaction time variance as well here up top, where typically you had a bit more of a spread compared to the sample case here. So what we're seeing is maybe at the start of the test, you were just getting into things, you're trying to maintain focus. Some of them were easy to respond to and quick, and some of them were taking longer. Again, throughout the test here, you've got more consistent reaction time, you're getting into the feel of things, and then at the end, the reaction time spreads out again, a bit more with a few extremes at the top. And this is where you're kind of doing that final push to complete the test and really maintaining that focus, but just making sure you were still getting them right. So taking that extra half second longer to make sure you were focusing.
Yeah, that's completely right, because at the end I was like losing the will to live. And it's a very long test. I was like, come on, you can do it.
So we look here at the rating scale results below. Now these are based on the DSM-5 rating scale. So the DSM-5, I'm sure Becky will know what this is, the Diagnostic Statistics Manual of Mental Health. So it's like a psychiatric bible of all things disorderly, of what is and what isn't. And what we see here, it just briefly mentions that children from the age of 6 to 17 must present often or very often or 6 items, and the same is true but only for 5 items for people over than 18. Now Becky reported here never or rarely for the majority of the symptoms here, so according to the rating scale results, this wouldn't meet the criteria for ADHD. Now this is where the QBcheck is really brilliant, because everyone's got their own interpretation of how they think their symptoms are. What you look at here is a comparison, which you don't always have with the words that we use to describe ADHD. hyperactivity, impulsivity and inattentiveness is something we've all felt in our life. So having a metric to compare to and this database of people who've done the QBcheck really provides a solid foundation for us to understand the extremes to which we have our ADHD or the extremes to which we don't. You know, it's just such a brilliant database from which you can compare your results to better understand the severity of the symptoms you think you have.
That's it's really good, because we have the psychometric test scores there, which are like question, answer. And I've always known, ever since I was like studying psychology, I've always known that if you give me a psychometric test, I'm going to give socially desirable answers, not because I want to cheat the test, but because I'm quite a positive person. So, you know, if the question is like, have you had difficulty focusing in the last 7 days? I'll just reflect on it in a very positive light. Yeah, it's been great. Yeah. And actually, if you look at the reality of the situation, that might not be completely accurate. So I don't even know that I'm like slightly falsifying the information. I just want to, you know, just like doing well on tests.
Yes,
so
yeah, definitely.
This is the high achieving nature. So like psychometric tests, I've always had a huge issue with them for that reason.
Definitely.
What's also interesting about psychometric tests is I haven't been stressed over the last couple of days, so therefore nothing in terms of my mental health has affected my concentration. But if you add a bit of stress into my life, concentration does, you know, change and stuff like that. So I think, yeah, psychometrics are very much about, you know, exactly how you are feeling in this moment, and it's, as you say, it's, yeah, people discount how they've been more recently.
Absolutely, and I think that's what's brilliant about the objective nature behind the test is it doesn't care kind of on your emotional state you were when you did it so much, because it's going to compare you to all these people who've done the test as well, who do and don't have ADHD. And so that really kind of counteracts that bias people have when they do the psychometric sometimes. So I guess now, the final question, kind of looking back on your life, having this information, can you think of points where, obviously you mentioned that you thought you have ADHD, but now, knowing the extremes to which those core symptoms reflect, can you look back and think of, actually, that makes a lot of sense there, and when I think back to that moment there, that makes a lot of sense for this, and it explains why I behave or why I did some of the things I did then?
I cannot even describe how difficult school was for me. It was very, like, the first few years of school were quite easy because you draw and like you learn your letters and, you know, everything's about play. All that was easy. But when it came to the point in school where you have to sit and listen, which I think from the age of, definitely the age of 8 was where I really started to struggle. And it was, I don't even know how to express emotionally how difficult it was for me. It was like the most painful, or one of the most painful experiences, because I didn't know why I couldn't pay attention like the rest of the kids. So I was labelled as like one of the, like, not naughty kids, but one of the weak kids, one of the, like, you know, so, and then in terms of my self-esteem, it had a huge impact on my self-esteem because I thought that I was stupid. So I've obviously done quite well in my life, and, you know, academically I've, you know, done incredibly well. I have about 5 different degrees, like, it's, you know, but I really have overcompensated, because from that young age of being labelled as someone who probably wasn't very intelligent, I spent a lot of my life trying to prove that I was. So it's really nice to kind of know that, oh, you know, this is just, I just have a bit of ADHD.
Yeah.
It's very reassuring. Now, obviously, I kind of self-diagnosed this a long time ago and sort of, you know, got over the attention difficulties. And, you know, as I said, in lockdown, I got an MBA, and I can navigate the university system very well.
Yeah.
I know how to pass exams. But actually learning for me is very experiential. I became a good psychologist when I was like treating clients, and then I would learn the information and do the research. But even doing my doctorate was a very difficult academic environment for me, because I was just given all this theory that doesn't make much sense until you're in the environment. So yeah, I think this test has been very reassuring for me, because it just confirms what I already suspected. So would you advise that I go on and have a full ADHD assessment?
Definitely. So I would definitely recommend you go on and have an ADHD assessment by a HCPC registered psychologist or a GNC registered consultant psychiatrist.
I know lots of them here.
Yeah, yeah, definitely, absolutely. And yeah, I hope the QBcheck's been useful in reassuring it. So if you think you have ADHD but you're not quite sure, and you're looking for that stepping stone to confirm the likelihood you have ADHD, the QBcheck is for you. If you're looking to see the benefit of the medication you've been on, then QBcheck is for you. If you're looking to assess the nature of which your ADHD might have changed through time to mitigate those symptoms more, then the QBcheck is a brilliant tool here at Private Therapy Clinic. Get in contact with us today online and book a consultation.